My name is Dr. Asha Shah. I'm the Director of Infectious Diseases at Stamford Health. I'm here to talk about COVID-19 vaccines for our youngest pediatric patients. I would recommend that parents get their kids vaccinated, especially this youngest age group, ages 6 months to 5 years old. Getting vaccinated is part of the public health response to this pandemic and will potentially get us closer to herd immunity. We know that the vaccines are safe and effective in preventing severe disease and hospitalization, which we have seen in our youngest children and the pediatric population throughout the past 2 years of the pandemic. So yes, it is a recommendation to get your kids vaccinated. Even having a history of COVID, that is not a contraindication to getting the vaccine because that protection you get from the natural immunity only lasts so long. Getting the vaccine enhances that protection and keeps your child safer from future infections. I think now's the time to get those appointments for a few reasons. We are still seeing a fair amount of COVID circulating in the community. Community transmission continues to be high in the state and in Fairfield County. And it takes a while for children in this age group to get that full protection because of the number of shots that are needed and the time period by which those shots are spaced out. So for example, getting a Moderna vaccine, it would take at least 10 weeks to get the full immunity from the vaccine, and that would actually protect kids for the upcoming school year, upcoming daycare schedules, and so that they're fully protected in the fall when we're expecting to see another rise in COVID. So the vaccines are a little bit different, so it's not so much about recommending one over the other. Again, the biggest differences are that Pfizer is 3 shots, Moderna is 2. If you're looking to get protection faster for your child, so for example, you have a big family event coming up or you have travel coming up and you need to get that protection earlier, you will get protection earlier with Moderna because of the schedule. So side effects were seen with both vaccines, both Pfizer and Moderna. The most common side effects that were seen with both were injection site pain, swelling, irritability, a little bit of decreased appetite, fussiness, and then the fever was more commonly seen with the Moderna trial participants as compared to Pfizer. In both trials, those side effects resolved over a period of a day or two with Tylenol, ibuprofen, and there were no long-standing effects seen. So the Pfizer vaccine is a 3-shot series. You receive the second shot 3 to 8 weeks after the first shot, and the third shot is 8 weeks after the second shot. You're considered to be fully vaccinated 2 weeks after completing the last shot in the series, which potentially means that it's 18 weeks to get fully vaccinated with Pfizer. The Moderna vaccine is a 2-shot series. The second shot is given anywhere from 4 to 8 weeks after the first shot, and the child is considered fully vaccinated 2 weeks after completion of that last shot, which is about 10 weeks from receiving that first shot. So if you have a question about how this COVID vaccine fits into your child's immunization schedule, it's something that you'd want to discuss with your pediatrician. Right now, we know that the COVID vaccines can be given at the same time as other vaccines. And so how those are administered with your child's other routine immunizations is something that can be determined by your pediatrician.